Hello everyone and welcome to my channel. We are starting the preparation for Peads TOACS. We are having 10 different stations of Peads in which some of these are instruments, some of there will be pictures, and some will be counseling stations and some will be interactive stations. So we will discuss all of these in this video. Okay, this is the list of all the stations that are we are having in the Peads TOACS. Okay, so we will be having the pictures of these diseases, that is kwashiorkor, marasmus, Down syndrome and hypothyroidism, and the questions about this disease will be asked. So we must learn these diseases in detail, that is kwashiorkor, marasmus, Down syndrome and hypothyroidism. Then we will be having some pictures of x-rays, which are the x-ray of pneumonia, then cardiac anomaly x-ray, and then rickets x-ray. These are very important x-rays. We will learn this in this video, and we should learn the EPI schedule. That is okay, we will learn the EPI schedule in Peads, and then the pneumonia, diarrhea, dehydration in IM and CI, which are the most important and common topics. Then we will be having a station, that is instrument station. So we will learn the instruments, its indications, contraindications and complications. We should learn the CBC, lumbar puncture findings and the urine RE. Then for short case, we will learn to examine the hepatomegaly and examination for the meningitis findings and some other topics like it. And then we will discuss the causes of hepatosplenomegaly, the causes of clubbing and edema, and we will discuss the growth chart. These are the most important things that we should learn in the Peads TOACS. So okay, following are the instruments that are present in the nursery. We will see the pictures in the coming part of the video. These are the important instruments, which are resuscitation tables, incubator, phototherapy lights, radiant warmer, infusion pumps, ventilator machines, CPAP, BiPAP and cardiac monitor. The important instruments that are present in ward are ambubeg, then laryngoscope, then nebulizer machine, then airway endotracheal tube, emergency tray, that is drugs, nasal prong, NG tube and suction tube and dial flow. These are the instruments that are present in the ward. Okay, these are the clinal, phenytoin, cortisone, hydrocortisone, dopamine, dormicum, midazolam, adenosine. These are the important drugs that are present in the emergency tray that we will discuss each one by one. These are the emergency drugs. I have mentioned this on the picture. So let's start our video. Okay, so first we are learning the TOACS instrument station. This is a dial flow, and the indications of dial flow are that it is used to measure the flow rate. Okay, the flow rate of any oxygen or fluid or anything. The contraindications of the use of this instrument is that it is not used in abnormal respiratory rate and wheezing and acute shortness of breath and recent surgery. It is contraindicated to use this instrument in the following conditions. The another instrument is airway, and this is used for respiratory failure and for hypoxia and hypercapnia and airway injury and trauma. In case of airway injury and trauma, we will use this airway, and the contraindications are bleeding disorders. That is, it can lead to overbleeding and bronchospasm and facial injury or skull fracture. It is not used in the case of facial injury or skull fracture. Okay, the next instrument is suction tube. The indications for suction tube are unable to cough and clear secretions, decrease oxygen saturation, and abnormal breathing pattern. The contraindications are it is contraindicated in croup, epiglottitis, and facial fractures and apnea. Okay, so this instrument is not used in the following conditions. The next instrument is endotracheal tube, and it is used. It prevents the gastric content entering the trachea, and it is used in respiratory arrest, agonal respiration, inability to protect airways against respiration, and it is used during general anesthesia in infants. The contraindications for endotracheal tube are that it is not used in severe airway trauma, obstruction, and cervical spine injury. So this is the endotracheal tube. This is the NG tube, that is nasogastric tube, and it is indicated when problem in the swallowing or sucking, and it is used to empty the stomach and to prevent the aspiration. The contraindications are coagulation problems and esophageal varices. The complications of the angiotuba are esophageal perforation, pneumothorax and empyema and pneumonia. Okay, the next instrument is nasal cannula or prong. The indications are supplemental O2. If child has O2 saturation less than 92% and if asthma, bronchitis or respiratory disease is present, then we use this nasal prong for oxygenation. The contraindications are critically ill patients, upper airway obstruction and central apnea, trauma, blocked nasal passages, and the complications are trauma to the nose and mild edema or erythema. The next instrument is ambubeg and it is used for indications are hypercapnia, respiratory failure, hypoxic respiratory failure, apnea, altered mental status. These are the indications. The contraindications are clinic suspicious of the tracheoesophageal fistula, diaphragmatic hernia, and lung malformation. Okay. Now coming towards the emergency tray. This is emergency tray and it contains different drugs. The most important drugs that are used in Peads is present in this tray and we are going to discuss this one by one. So we are having this emergency tray. It contains epival. Epival is drug for epilepsy. Then it is having vancomycin. Vancomycin is antibiotic against gram-positive bacteria. Then decadran is present in it. It is a dexamethasone and it is used in arthritis and blood hormone disorders. Then atropine is present in it. Atropine decreases saliva and fluid during surgery. Then Avil is present. Avil is used for allergy, that is hay fever and runny nose. Then Lasix is present. Lasix is for swelling of ankles, feet, legs and brain. Then adrenaline is present, which is used in severe allergic reaction. Dobutamine is present, which is used in heart failure. Vitamin K is present, which is used for blood clotting. KCl is present, which is for hypokalemia. Methylprednisolone is present, which relieves inflammation and redness. Calcium gluconate is present, which is used for hypocalcemia and cardiac arrest. Dextrose is present, which is used for dehydration and hyperkalemia. Dormicum is present, which is used for sedation. Acyclovir is present, which decreases pain, increase healing of the blisters. Then Hemacil is present, which is used for intravenous colloid and the treatment of the shock. Then gentamicin M is used, which is used as anti-malarial drug. Then MgSO4 is present, which is used for constipation and hypomagnesemia and prevention of the seizures. Then hepamers of the liver tonic are present, which are used for acute and chronic hepatitis. So here in the emergency tray, we also have discussed the most important drugs that are used in the Peads. These are epival for epilepsy, vancomycin antibiotic, decadran is decamethasone, atropine, Avil, Lasix, adrenaline, dobutamine, vitamin K, KCl, methylprednisolone, calcium gluconate, dextrose, dormicum, acyclovir, Hemacil, gentamicin M, MgSO4 and hepamers liver tonic. Now coming towards the next instrument, it is infusion pump. The infusion pump is used to deliver nutrients and medications and insulin, and the contraindications are the risk of infection and complexity. It is not used when there is a risk of infection or complexity is present, and it is used to deliver the nutrients. The next instrument is suction machine, and it is used to increase the audible or visible secretions, and it is used in case of unable to cuff effectively the clear secretions, and it is used to decrease the O2 saturation. It is used when there is decreased O2 saturation. The contraindications are bleeding disorders, bronchospasm and facial injury. Suction pump is not used in bleeding disorders, bronchospasm and facial injury. The next instrument is this is phototherapy. Infant radiant. This is infant radiant warmer, and it is used to provide the thermal support to the newborn in delivery and a baby born before 37 weeks. It is used for the baby who is born prematurely. The contraindications are extreme hyperthermia. In case of extreme hyperthermia, it should not be used, and the indications are that it provides thermal support to the newborn in delivery and baby born before 37 weeks. The next instrument is cardiac monitor. and it is used to measure the heart rate, the pulse, the strength, and the respiratory rate. The complications are device rejection phenomena, device migration, infection, and erosion through the skin.